Hi friends, we are going over our 5.7 quiz. So I look forward to doing that. Pull up your 5.7 quiz and we are going to review. So question number 1, childcare providers can help children with hearing disabilities by, we are never going to yell to see if a child can hear. It's absolutely not the right answer. So we want to just speak in a normal voice. We use some visual cues. That means I would point to something when I say, do you want to go over here? And I would point as well. Use gestures and facial expressions to clarify your message. So I have a banana in one hand and an apple in their hand. Do you want a banana or an apple? So I'm using that to clarify the message. I might post pictures to show directions. So you would have a schedule for the class and you would have a picture of a chair and then a picture of a notepad and then a picture of a pencil. And these are the 3 things that are required for like in this area so that they could have some visual pieces. So all those are ways that we can help a child who has that hearing challenge. Vaccines cause autism. Is that true or false? And that is absolutely false. You are right. It does not. The research from a long time ago they found was not real, and it was all faked. So they could never reproduce that research. So if you see that, it's one of the reasons why it's so important for people to look at research and use research that's very recent, because older research can not be accurate anymore, or could have found that somebody found something different and how it's not the same. So question number 3, what is the correct sequence of events once a child aged 0 to 3 has been referred for evaluation for special needs? So if you think about it, you're always going to do an evaluation first. So that tells you number 1 is the right answer, but let's go through the rest of them. So the first thing you're going to do is you're going to assess. I have to assess before we determine if there is eligibility. So you're going to evaluate first. You're going to determine if they're eligible. From there, then you're going to move into different plans. So there's an individualized family service plan, that's IFSP, which is different from an individualized education plan. Individual education plan, and that is what is at the school district. So that's why it says 0 to 3. So this is like an IEP at school, but it's for young children, so it's with families. So an IFSP is developed, and then services are provided. And then after the services are provided, we try to transition or have a review to determine what else is needed. So we're definitely going to have evaluation, determination of eligibility, getting a plan, getting services, and then reviewing those services. What does ADHD stand for? Give you a moment to think of it yourselves. It is attention deficit hyperactivity disorder. Great. Question number 5. Which is not a sign associated with a childhood ADHD diagnosis? So when you think of ADHD, you're thinking attention deficit and hyperactivity. So hyperactivity, I'm moving around a lot. I tend to talk a lot more and make more noises than other children. That is absolutely the case. They tend to not only use physical movement for hyperactivity, but they have a hyperactive mouth. Actually, this is true too. It is a sign of ADHD because ADHD is about the connection of synapses, and they have a hard time hopping on one foot by the age of 4. One of it is about a right-left connection, and one of it is about having that center of gravity. Remember, we were talking about helping children with ADHD, and they might need to strengthen their core strength. So that is actually the case. ADHD, they tend to be very talkative. So they can wear them up to strangers, they may not, but that's not a thing. Dislikes or avoids activities like requiring to pay attention for more than 1 or 2 minutes. So they don't like having to do activities that require a lot of attention. So that is true. If you suspect a child has a disability or a neurodiversity, what should you do? You should refer a parent and child to just a doctor, a pediatrician. You can put specialist, but it's easiest just to type doctor. You don't get to make the assessment yourself because you, unless you are a pediatrician, don't have the qualifications to do that. Oops. Which strategy applies when caring for children, when caring for a child with autism spectrum disorder, ASD? So let's see. Does it apply if you follow the child's routine, especially at bedtime or meal times? That is a yes. Oh goodness, I don't know where that picture went to. Hi. So following the routine. Okay. So follow the child's routine. Determine the objects that make the child feel comfortable. For example, their favorite toy so they can play together. So schedules, routine, that all makes children feel more comfortable. Okay. Don't be offended if the child decides to play alone or limits interactions with you. That is correct. Absolutely, right? And then go slowly when it comes to physical contact. Because remember, we talked about the fact that autism spectrum disorder, that type of diversity can feel uncomfortable when people are very close to them. It's not always the case, but it could be the case. So we want to watch. We want to watch for that. A special needs child is defined as a child with a lifetime impairment in one or more areas of functioning. Is that true or false? And that is going to be true. The reason, remember, that it's true is we are looking at not just if I have a special needs as something that's life limiting impairment. So, for example, I wear glasses. And so that is, I need corrective lenses for my glasses. But that's not life limiting for me because the world has glasses and contacts that will make it where I can see that equal the plane. So that's not a life limiting impairment. So we're talking special needs is anything that limits life in one or more areas. If a child was developmentally delayed, the child didn't start walking until they were 2 years old, but at 2 years old they started walking, and now they're 15 years old and they walk, then that was a developmental delay. That child is not special needs because it wasn't a life-limiting impairment. Hope that makes sense. So we're going to match the type of disability with an example of a disability. So we have the point that you want to get is that there are challenges on a physical domain, on a developmental domain, on a sensory impaired domain, and for sensory impairment, and then also for behavioral or emotional emotional. So let's see. It's not a disability to be hungry. On a physical, let's see, is multiple sclerosis. Now, multiple sclerosis is when your spine is moving back. Now, some of you might have thought of blindness. That is a physical impairment, but it is a sensory impairment. So not being able to see, not being able to hear, not be able to feel things, that is a sensory impairment. So blindness is a sensory impairment. Does that make sense? Okay, developmentally. So we're thinking of something developmental, and that's going to be, I'm not learning at the same rate that somebody else is, and it will become a special need if I don't get to catch up. So we're supposed to read at a certain age, and you're having trouble reading by that age, then you have learning disability. If that disability becomes, has a life impairment for you, then you are considered in the special needs category. Okay. Emotionally, we're thinking of depression. We're thinking of, anxiety. We're thinking of one of those things. Again, a physical splinter doesn't really put you in a disability category. The flu, you're going to get over it. The common cold, you're going to get over it. So this has like a longer lasting impact. These something with a disability. Suggestions for working with a child with a developmental delay include all of the following except. So what we're going to do about it is we're going to teach in small steps. We're going to give very clear directions, speaking slowly, clearly, and using only a few words. Even though all children need naps, all children need sleep, having a child have more sleep than other children isn't necessarily have anything to do with developmental delay. We're going to move, this says accept, so that's going to be the right answer. Move the child physically through the task so that they can feel what to do. Yes. So we're going to try to have them have the behavior in their body and do it within their body. So when I'm learning how to play golf, I'm going to use my arms and I'm going to practice my swing. And when I practice my golf swing, I'm going to feel it in my body. So we want to help them to work physically through something so they can feel what it feels like to do it, to accomplish it. And then it's also helpful, sit or stand close to the child so that you can help as needed, especially with those developmental delays. You're trying to get them to move to that next step or help them with it. Now remember, sitting close to a child with ASD for autism spectrum disorder is kind of a challenge. So you have to think and watch about that. Okay. And there are dual diagnoses. That's why it's super important to know what the diagnosis is and what that looks like. So, children with ADHD, do they grow out of it? And the answer is absolutely not. They don't grow out of it. As an adult, you have ADHD. You might have more coping skills. So it is imperative, whether the child has medication or not, or needs it, to be giving lifelong coping skills to a child who has attention deficit hyperactivity disorder, because they will have challenges with that attention and hyperactivity for their lifespan. So what are some of the causes of this? Low birth weight, alcohol and tobacco for sure, brain injury, watching too much television is not the same. Genetics, living in poverty is not the case. Premature delivery should be, yeah. A child is born with attention deficit hyperactivity disorder. There's nothing that a parent did to get that child to have this neurodiversity. So perhaps if there was something that happened in utero that was complicated, sure, but you don't catch it. You don't catch it or get it. Those are behavior complications. That is not what attention deficit hyperactivity disorder is. It actually is a different way that the brain works. So what are the benefits of discipline? The benefits of discipline are the same whether kids have special needs or not. Is that true or false? 100% that is true. Stay tuned for our part 2 of this quiz.